Myself, Dr. JIBRAN Ahmad presents to you Simply Pathology, and today we are back with a very important session. Now, today's topic of discussion is quite different from my usual topics of discussion. So, today, as you can see, I am going to discuss mainly on the mental health and how to tackle with depression or the problems that you are facing during your residency. Okay. So, you must be thinking that why sir is, so much interested in taking or, discussing on an issue like this. So basically, it is not it is not an unknown thing, because now it has become very common for a PG resident to commit suicide. Now, although this was there for a long period of time, okay, this has been there for a long period of time. So why is it that now I have decided to, make a topic on this particular, mental health? So the thing is that most of these things, okay, most of these suicides, they were affecting, residents from the clinical department. But in March 2024, one of my very good students, one of my very bright students, okay, had attempted suicide. And, that student, whenever I had spoken to that particular student, the student was very happy, and, there was no sign symptoms of depression, or, it came as a shock. Okay, when his parents called me and they told me that such and such thing has happened, this and this thing has happened. So I was quite shocked that why this thing happened at the first place. And even when you are there are certain students who are always worried, and there are certain students who are always they are always worried about something. They always have a fear of failure, and if something like this happens to that kind of a student who is always in anxiety, so you can understand. But when a happy going, a very sharp, intelligent student, okay, who is doing well, okay, across residency, when such a student, takes, tries to, take such a drastic step, then in that situation, you do think, that where is it that we are going wrong as a society? So this is one of the reasons, why I have decided to make this video. And if you see, right now is June, and this situation has occurred in month of March. So there has been a gap of nearly 3 months, 2 to 3 months time has elapsed, okay, between this incidents and making of this video. So the reason that I am making this video and the reason of the delay is that I was speaking with multiple residents, and I was doing a lot of surveys and lot of studies and research on the mental health of the residents, so as to understand that what the problem is or where the problem lies, and what is the best way, in my opinion, to deal with those problems. Okay, so this is the reason that there was a delay between this incident and making this particular video. So in this video, I am mainly going to discuss about the mental health. I am going to discuss what are the problems that are faced by the residents and how to identify those problems, because in majority of the cases, the student or the resident is not able to identify that particular problem. Okay. Second thing, I am going to also discuss the ways that you can fix those problems. Then I am going to give you a guideline about the basic do's and don'ts during your residency program. And lastly, some basic life lessons. Okay. So I would like to start off with this lecture, okay, by just highlighting that the latest incident of postgraduate resident taking his own life, okay, is last month only, which is not even a month from now, 18th May, I think 18th or 19th May, the news came out that in Dehradun, a first year postgraduate resident in the field of pediatrics has taken their life. Okay. Then again, I had, if you see, last year, in October 2023, a second year postgraduate resident, okay, in Tamil Nadu has again taken their life. Okay. Okay. Not only that, there are very eminent institutes like Safdarjung also. There are, a third year postgraduate resident in Safdarjung. Okay. They have also taken life. So one thing is very clear, that no matter, okay, whether you are a first year postgraduate resident or a second year postgraduate resident or a third year postgraduate resident, okay, so there is a common factor that is there throughout your residency period, which is triggering you to take such a drastic step. So it is not like only the first year. Yes, the incidence is far more in first year because the mental pressure is much more in the first year as compared to the third year and second year. But there is a common factor which is in, which is there, and only residency is not to be blamed for that. there are many other factors which are also, to be blamed. Okay, so very importantly, okay, and what we have already seen, that most of these incidences are affecting the clinical department, but not only that, right now even the paraclinical and the preclinical departments are affected by it. And you will be surprised to know that your residency or your department or the toxic work culture or whatever that you attribute, to your department, okay, or to the toxic culture or to the workload that is there, it is not the only reason. It is one of the major reasons, but not the only reason which is, causing you to take such a drastic step. So as I have already said, that first and initial, thing that we are going to do today is to identify that really what is the problem or where is the problem, because till you do not identify what the problem is and where the problem is, you cannot address the problem or you cannot deal with it. So that is the second point of discussion today. Thirdly, I am going to lay out that what are some of the important do's and don'ts in residency program, and lastly some basic life lessons which according to my experience I am going to share with you. Okay, because I have also been through the same journey of MBBS, same journey of MD residency. Okay, so I have some bit, certain idea is there of how to deal with this situation. So based on whatever little knowledge I am having, okay, I am going to share that with you. Okay, so first thing, that what is the problem? Okay, what is the cause of this anxiety or depression? Now, first important thing that you have to understand that that we have a very basic layman knowledge about what depression is. Even among doctors, even among medical practitioners, usually people think that depression just means when you have a low mood or you have a bad mood. Okay, when your face is down, when you are not very, when your facial expressions, they do not match up to the society standards. Okay, that amounts to depression. No. Depression always doesn't present with a low mood or with a bad mood or with a low energy. Sometimes depression is also expressing in other ways, and not sometimes, many a time depression is also expressing themselves in a certain way. For example, if you have stopped enjoying doing certain things which you used to do previously. For example, previously you always used to enjoy a certain food, but nowadays even after having that food you don't feel any kind of enjoyment. Or for example, previously you used to go for car drives or used to go to a cinemas, that used to give you joy, pleasure, but recently or past 6 months, past 1 year, past 2 years, you have stopped enjoying certain things that you used to enjoy previously. Okay, this is one of the signs of depression, or this is one sign of problem. Or for example, you have started having more food than usual, or you have completely reduced your appetite. Similarly with sleep also, either you are sleeping a lot or you are sleeping very less or not at all. Okay, so this is far more common as compared to the other thing. So this is also not a normal thing. This is also one of the signs of depression. Thirdly, and one of the most important factors, okay, which is pointing towards depression, okay, is not able to concentrate on any one thing. Now, most of the residents, they have complained about one thing that I have seen, that is that, sir, even though I am having time when I am coming back from work and I have time, even then I don't concentrate on my work very nicely. And when one resident told me about this, I thought, okay, this is something, okay, this is something, one usual individual problem. But then when I had gone to the WHO definition of depression, so one of the most important highlighting factors was when you are not able to concentrate on any one thing. Okay, so, and one of the biggest reasons for this is the smartphone that you are using, or the iPad, iPhone, or whatever, this phone, this mobile phone, this access to high speed internet, access to YouTube, Instagram, Facebook, Twitter, access to news channels, or access to everything at your fingertip. So even 1 minute or 2 minutes, you are not able to stay without the phone, right? And how it is contributing towards making your life difficult, I will discuss in the later half when I will discuss the impact of social media in your life. Okay, so one of the biggest signs of problems when it is there is not able to concentrate, when you are not able to, inability to concentrate on any one thing. Okay, And one of the other signs of depression is where you feel worthless or where you feel hopeless. So worthlessness and hopelessness. Now, what is a very scary part in all these four important points that I have discussed, that in all these four things, from externally you don't seem to have depression. Externally you are laughing, you are kidding, okay, because all these things, they form part of your life and you don't even realize when you started having more food, when you started having less food, how your concentration is going, because you are constantly in your phone or you are constantly thinking about something, okay, and then you are in the end all the time is going and you are not able to finish your task. Okay, that is also one of the major signs of depression. Okay, but it is not something that anyone will ever think that because I'm not able to concentrate, that means I'm in depression. But this is one of the important factors. And sometimes an individual feels hopeless and worthless, okay, without expressing the same opinion about them. No one will come and say that I'm hopeless and worthless, but you feel about yourself, you feel like that. The feeling of hopelessness, worthlessness, uselessness, that I am to not useless, I am to cannot do this, I to cannot do this, So, but once your mind goes into that state, you start to fall into depression. And all these things, they don't take place in a span of 1 or 2 days. Rather, it is a it is a gradual process which keeps on developing over a period of time. Now, basically, why what is the reason why you feel worthless or why you feel hopeless? So there are some of the important reasons that I have that I've come across, that why a resident feels, and mostly the first year residents, especially because they don't know anything about the residency program, they have the least amount of knowledge, they are inexperienced, so they are a constant target of judgment from the faculty members. So this is one of the most important reasons why a resident feels worthless or hopeless. Secondly, a competitive environment that is there. For example, you are having a seminar or you are having a case discussion. So the teachers, they like to ask questions, and when they are asking questions, okay, you may not know all the answers, but you see your colleagues are answering, the seniors are answering, second year, first year, second year, third year residents are answering the question. So in that situation, you think that I have never even heard about this, and these people have so much knowledge about these things, okay. So that gives you a sense of worthlessness or hopelessness. Thirdly, when you are not able to do well in exams, for example, you are having certain preliminary examination or certain departmental exams are there. So you are not able to do very well in the exams, or even after having read a lot, you are not able to reproduce or recall many things because maybe the revisions were not adequate or you did not find the time, okay. So you're not able to do well in exams, you're not appreciated for the hard work, especially the first year residents. So all the clerical work are being given to the first year residents, and it is not like the first year residents are not doing, in fact they are the most hardworking, but they are the least appreciated ones because they are all the seniors will give their clerical work to the first years, and you are nowhere, you are not in the eyes of any faculty or anyone. You are just a person who is doing a clerical work under the fear of your senior, junior, or any other faculty also. So you are not appreciated for the hard work, so that can also give you a sense of worthlessness or hopelessness. And most important that I am going to tell you, which no one is talking about and which is a very important or a major factor according to me, is the social media. The social media has become the largest silent killer in today's world, which no one is talking about, okay. So in the social media is such that, for example, if you are not a millionaire, or if you have not traveled the world, or if you do not have a perfect 6 abs, or you don't have a perfect size 0 bikini body, or if you do not own a luxury car like a BMW, Audi, or a Rolls Royce, or a Land Rover, or if you do not have a lot of following, at least you should have 100,000 followers. If you do not have this, then you have been declared a failure by default. By default, it is a failure. And I have started to question the values of our social system, of our community, of our people at large. You know why? Because recently you have seen that there has been an Ambani pre-wedding, right? And I have nothing against the Ambani. They have work very hard to be in the position they are, and they have done some things which we and you as a normal human being, we are not able to do. And they have a lot of money, and it is completely all right for them to have an extravagant wedding 10 times more than what they have portrayed in the media. That is also all right. It is not an issue. But where the issue lies is when you are showing a normal person the amount of money and wealth that you have spent, which is even unthinkable by a normal individual or a normal person. So when a normal person is being fed, okay, all these details of Ambani pre-wedding, that is something which is unachievable. Okay, and that unachievable, I'm not saying they cannot achieve that, but literally to think about something like having 10,000 crores or having spent around $1 billion, near about $1 billion, okay, near about $1 billion in just one wedding. Okay, so something like this becomes really unattainable, and when that thing becomes unattainable for you, you start to feel like a failure. And this doesn't work directly with you, it works subconsciously, and it is affecting not only, this is something which is affecting not only the residents but people at large. So please be very careful about this in the social media. Okay, so I'm not discussing right now how to deal with them, but rather I am just highlighting that some of the important problems that you need to identify, that these are the things which are creating a sense of worthlessness or hopelessness in you. So you have to recognize those things. Thirdly, there is availability of so much unnecessary information and addiction to the smartphone. This is also one of the problems that is being faced. Now, for example, leave the depression that you are having after looking at 1,000 things. You see one millionaire, one child became a millionaire. Leave that. Even once you are in your phone, in your YouTube, or in any website, in news, there are just so many information that your brain has to process. So if your brain has to process so many information every day, you start watching series, at the level of your hand, you have access to Netflix, Amazon Prime. So many things are available today. So you keep on binge watching one thing after the other, one thing after the other. Then you go to YouTube. Then after YouTube, you migrate to Facebook. Then you go to Instagram. You see your friends. You see celebrities. You see, there are so many information that your brain has to process every day. So in comparison to what 20 years back, our life was, in comparison to what it is today, your brain is always exhausted. So whenever you wake up also, your brain is exhausted, because at night before you sleep, you are in your phone. You start to sleep, you go to bed at 10, but you sleep nearly around 2 o'clock at night or 3 o'clock at night because you were busy watching something. So that brain is very, very exhausted. Okay, and that is directly or indirectly, it is one of the reasons, or one of the problems that is leading to depression. So today's generation, if you see, it is confused. They are confused. Now I will tell you one more important fact. Today, if you see in the social media, there are so many success stories. Okay, few success stories once in a while, okay, it gives you inspiration. But every day and every other story, now for example, I'm telling you, I'm not taking a dig at anyone. I'm not telling you anything about anyone. But every other person in the social media, okay, they are telling their success story. I was this, I didn't have this, it will start, we did not have access to this, we were very poor, we were living in such a small jhopadpatti, okay, and we did not have anything. For my school, I used to go this many kilometers, I used to walk, I did not have this. And then they will say, now today, see, I have so many things. Now, so many success stories when you see, and then you start comparing yourself with them. And what happens, that you realize that, okay, I have also been through so much of struggle. Why am I not getting, why am I not getting so much of, success? And why do I have to see the success stories of other people again and again and again? So this is creating a negative impact after a certain point. Okay, so this is one of the important things. So again and again and again, if you are made to see the success of other people, other person, it will give you a sense of hopelessness or worthlessness, contributing to your depression. So something I would like to highlight to you about social media, about the internet, about the YouTube, that see, YouTube should only be used as a source of valuable information. You need something, you need, for example, you want to buy a camera. So there are lots of good information which is available about buying a camera. You go and see those videos. Okay, you spend some time and energy on that. Yes, really you will get an idea and you are able to make a good decision. You want to buy a car, see multiple reviews, see multiple colors of the car, or whatever car you want. You have multiple information today in YouTube. So similarly, if sometimes you want, to get entertained. So for example, you see a comedy show. Okay, so even comedies or even certain, light things or even some serious drama is all right, is not a problem. So use YouTube for these things only in a limited manner, You shouldn't be addicted to the same. Like for example, you start scrolling your internet. You think 10-15 minutes I'm going to scroll, and you end up scrolling, sitting for more than 3-4 hours, gone. And this is happening on a daily basis. Please remember one thing, barring one very famous YouTuber, all the other YouTubers that is there in YouTube, they are there to earn money. So whatever they are showing you in YouTube, okay, is not necessarily in your interest. Their main target is to have as many audience as possible. So they are going to make their channel as much, pleasing or as much, attractive as possible. So they can only do this with some kind of information which is portrayed in a very bad way. Nowadays you will see that you are having rice is a killer. You are having sugar is a killer. Then you will have another group of people who are saying the opposite. Then it is creating a lot of confusion. So you will always see in YouTube, there are some group of people who are saying one thing. There is another group of people who are also saying one thing. And there are some group of people who are saying the correct thing, but they are saying it in such a manner that is creating a lot of, controversy or something like that. So that is why remember, whatever you see and everything you see in the social media, it is not true. Remember that thing. And they are there to earn money. So it is serving their interest and not your interest. So remember this fact very clearly. So I hope once you understand this point, you will better utilize your time in, with the internet. Okay. So very important thing is, now this was a survey which was conducted by me in the month of March, okay, especially for the pathology residents, okay. So among all these problems, okay, the first and the most important and the first ranking problem was that, sir, I want to learn. If you can see over here that, sir, I want to learn, but that no one has the time to teach me. The second most important problem was that they were having an unnecessary fear of failure. The third important problem that was faced by them was that, sir, I am not understanding anything. Fourth important problem was harassment from the professors or from the HOD. Okay. So, and the fifth important problem that was there, that, everyone is just thinking about themselves. No one cares. Okay, in short. And there were other miscellaneous causes also, like relationship issues or having pressure from the in-laws, or you have, along with your residency, you have to take care of your family, and, and yes, this is also one of the very important problem, because most of the pathology residents, they are females, and usually during their residency, they are getting pregnant, they are having a child, and they are missing out on a lot. And this pregnancy itself is something which is, which takes up a lot of your energy, and, it is itself a very exhausting process. Okay, the entire pregnancy, post pregnancy, you have a child, okay, and then taking care of the child, and along with that doing your residency, it's a lot of mental pressure. So that is also one of the very important causes that can, force you into depression cycle. Then, jealousy with your co-PGTs, or, sometimes you're just not interested to do any more work. Okay, so you're not interested, you are you are in a residency not of your main choice. So those are also some of the contributing factors. So taking each and every point into details, we are going to discuss each and every problem in details. So before we go on to the problems and how to fix these problems, remember, any of these things, any of these problems that I have discussed, if you identify, and if such a problem is taking place for a long period of time, okay, then suddenly one day you will see that a person has taken a drastic step and it culminates into suicide. So this is what I want to make you understand. So the first part of my session was to make sure that you understand what the problems are, okay, what the red flag problems are, okay, and how to identify those problems. This is the first thing that you have to understand. Okay, first important thing, not only low energy, low mood doesn't constitute depression. Okay, it does constitute, there are signs, but sometimes those signs are not present and some other signs are present which you are not aware of, which I have made possible for you to understand. Okay, if apart from, if you are not feeling, if you have a proper energy, your mood is all right, even then if you don't enjoy things that you enjoyed previously, reduced food or increased food intake, reduced sleep, increased sleep, inability to concentrate, and a sense of worthlessness, all these things, okay, they contribute towards your depression journey. So please be aware of that. Even it can lead to depression, or it can also lead, alternatively to anxiety also. Okay, and these are some of the important problems which have come, which has come into the view, okay, after having conducted lots of surveys from the residents. So now the important thing is that, sir, you have highlighted so many problems that are faced, but how do we deal with them? So I would always say that remember these 3 points very importantly, and the most important thing is communication. You have to communicate about your problem. Majority of you, you have problem called X, okay, and you will have fight with some other person, or you will have some jhagda or some conversation, about a problem Y, which is a very minute little problem, superficial problem. You do not speak about your major problem, which is your X problem. So about your major problems, you're always hiding. So you have to communicate. Communication is very important, right? So communicate with who? Now most of the residents, okay, or most of the students of this age, that is around 24 to 30 years of age, between this age group, they do not like to share a lot with them, with their parents. Okay, so usually they want to share all things with their friends, and usually in residency you do not have that kind of friendship that you used to have during your school. So if you have your school friends, or some very old friend, bachpan ka dost that we say, to share your problems with, okay, so always communicate. And even then, if you don't have, you can always communicate with us. Okay, at Simply Pathology, we are always there, and right now we have also started our counseling sessions for the residents. Okay, so that you have a better communication, because once you communicate, okay, so even because see, your mind is always blocked in residency, and you are inside a problem, so you do not have a view about the problem very nicely. So someone who is from the outer aspect, or someone who is from outside, okay, they can get a better view of the problem than you can, and they can guide you much better than you can. So that is why communication is very important. Okay. Secondly, having a clarity. Now, one of the major things, okay, that is there is the clarity of vision. Means the clarity of work that you are doing, what you are doing, what you want to do. You should have a clarity. You should have the goals defined, that I want to do this. This is my residency. These are the things that I want to attain. These are the things I wish to do well. These are the things I wish to learn. These are the things these are my targets. You don't have a preset target. You're just going on with the herd. Okay, so having a clarity is a very big thing, is a very good driving force that helps you drive yourself and helps you clear your mind of the clutter, because once you have the clarity of what you have to do, okay, then all the clutter is gone, okay, and the concentration level is well maintained. Thirdly, having patience. Patience is very important, and trust me, with the residents, and especially the first year residents, they do not have patience at all. They have no patience. You just remember one important thing. Your bad time as well as your good times, they are not permanent. Both of them will pass. Everything will come to you in due course of time. So having patience is very, very, very important. Please practice, patience. I say to people to practice patience. Take a deep breath, okay, and try to have patience. This is very important. So these are the three important basic things that will help you solve 99% of the problems. Now I am going to come across individual problems faced by the residents and how you should deal with them. So as I told you, the most important thing is problem that is faced is that all the residents, especially the first years, they have a wish for learning, but no one is there to teach. Okay, and one other problem which is also there, which I will also discuss under the same heading, is that, sir, I don't understand anything. Because of that, I feel depressed. Now, I would like to tell you that these problems are, majorly, these problems are faced by the first year residents. Now, first thing you have to understand and you have to make it clear, in your MBBS, you are very chilled out and you always pass, because in MBBS, the teachers and the faculties and, the people at large and the administration, they are looking to pass you, whereas in the professional residency course, they are looking to fail you, because they want to know that what you don't know, whereas in MBBS, they want to know what you know. At least he had answered this thing in MBBS. But in case of residency, the teacher is looking at what are the things that you don't know. They are more interested in that. Okay, remember this point. So you are in a professional course, you are getting paid, you are coming morning 9 o'clock till 5 o'clock you are there. So you are in a professional course, right? So in a professional world, usually you will never be spoon fed. People will be available to help you. Okay, you are trying hard to understand something. In the course of that, you did not understand some small thing. You did not understand one or two things. So you go and ask maybe the senior, junior, anyone, and then they will definitely help you. But if you expect that a teacher or a resident or a senior will sit beside you, hold your hands and show you each and everything inside the microscope, I am very sorry to break the news to you, that is not possible. So if you have such kind of expectation, that is a wrong expectation to have. Okay, and remember one thing, learning is very much possible. The thing is, one thing the teacher is asking you, you are not able to answer, and that is the end of world for you. After that, you will be in depression for one whole month and you will not even touch the book. This is something which is wrong. And it is also wrong on the part of the teachers to always ask something. See, it is not like all the teachers, they are asking you in a sadist way, or they are asking you questions that they know that you will not know, and they are getting some kind of, they are getting some happiness out of that. Okay, but it is not like all the teachers are like that. Okay, teachers, they love to ask questions, but many of the teachers, they are asking questions so that, for example, it is just a habit. But asking questions is also important as a part of residency program, because if they don't ask you questions, then you will never be stimulated to learn. So that is, so you should take that asking questions from the teachers, or as a drill. You should take it as an opportunity to learn. Okay, you don't know this, you go and search about that. Don't become depressed because of that. So learning is very much possible. There is a certain, we have made so many videos. I will be sharing the link to all those videos that I have already taken. For example, how to approach residency. A very beautiful video is there on Pathology Residency Decoded. Okay, please go and watch that particular video. I have already given how to go about your residency. Again, I have also given you the exam approach, that how is it that you have to approach your exams, and for that how I have broken down everything. First year what you have to do, second year what you have to do, third year what you have to do. It is very much possible. I have been through the residency, I have been through a government college where no one had time to teach me anything, but I have taken the book and I kept on reading. The idea is, there will be certain bad days, there will be days you will not be able to answer, there will be days that you will be shouted at, there will be days where the seniors will say something to you, there will be bad days as well. But remember, these days are not constant or permanent. They will be accompanied by certain good days also. Okay, so please remember one thing, especially the first years, please give yourself some time and don't beat yourself up. Remember, Rome was not built in a day. You are in a residency program, and even a lifetime is not enough to know about a subject in detail. Even the professors, teachers, they are learning over a period of time. They are also learning. Okay, and you have just started on with the process of learning. So you will take some time, and provided you have to start reading the books, you have to start your lectures, you have to start watching from the app, you have to start somewhere to reach somewhere. If you don't start, if you don't watch, and if you just come up with an, see, no one is not teaching, no one doesn't have a time, it is very easy to blame. But blaming will not solve, rather it is going to make you more frustrated. Okay, remember this point very importantly. So as I already told you, you have to read, you have to observe, you have to learn, and you have to repeat this thing. And once these things are carried consistently over a period of time, in 6 months time, it is my guarantee you will see 100% improvement. And I have already told you in all these videos how to approach. One of the things I told you, that at least you see 5 slides per day. First year resident, they are saying that, sir, I cannot understand anything under the microscope. See, to understand something, you have to read something. You see, and just think, you are expecting that a professor or a resident sit beside you and teach you one and everything. Now, if they start doing that, think in a very practical way, who is going to report the slides of the patient? Are you going to report? No. They have to report. They have to deliver the reports within a certain time frame. Yes or no? Right? The seniors are having some responsibility in a day. They have to finish their responsibility. They also have to read, because they also have to pass their exam. So sometimes you be in the other person's shoes also. But what you can do is that you can read something. If you don't understand after reading, then you go with your doubts to the professors, and then they will clear your doubts. Understand? And remember, you have to give yourself some amount of time. It is not like from the first day you will be able to answer all things. From the first day the questions will be asked. But the questions are also important, because that questions is going to stimulate you for learning process. So remember this point very importantly. Okay. As I told you, a teacher, when asking question and when you cannot answer, okay, and someone else is answering, okay, so that doesn't mean that is not an end of the world. So residency is a part of the life. It is not your whole life. So don't make it a do and die situation. Okay, it is, after having spent so much time in residency, and now almost 4 or 5 years after my residency is over, so when I think about those things in residency, I think that kya hai? It was nothing, and when I hear residents right now, they are so much scared, they are so much agitated. I am thinking that, after 3-4 years, after you finish your residency, you will laugh at all these things. Okay. Just remember, don't come into the cycle of complaining and nagging. Okay. There are certain residents, even in my time of residency, I used to see certain residents, they were always in the cycle of complaining and nagging. They were always crying. And why I tell you, don't be that person who is always complaining and nagging, and they are always having their sad story ready in front of you, in front of the teacher. Why? I'm telling you the reason why to avoid this cycle, because first of all, no one cares about your problem. No one actually, no one has the time to care about your problem, and even if they have time, they don't want to care about you. Because if you start becoming that person in the department, you start to irritate everyone, and no one wants to be around that person. You ask yourself, do you want to be around a person who always cries or always, is talking about their problems? You yourself will not want to be around that person. Then why become that person? And thirdly, okay, when you discuss your problems with anyone, people are happy that you have them. There are many people who are happy that you have them. So why to cry, why to nag, why to complain about your problems in front of anyone? Keep it to yourself. Don't be that nagging person in the department. Okay. So this is how you have to address this first problem, that no one is there to teach. So, I don't understand anything. It is not like this. First thing, you have to read yourself. You have to open the book. Once you have doubts over there, after you open the book, then you ask the residents, your senior, junior, you can ask your senior, second year, third year, you can ask the faculty members, okay? Ask different faculties. Don't get stuck to one faculty. I'm 100% sure once you start reading, it is all going to make sense to you. Secondly, as I told you, in your department, start seeing the slides. And once, for example, if you want to see the appendix slide, see chronic cholecystitis, gallbladder, lymph node, the hyperplasia, okay, lymphadenitis. All these are basic slides which are always there in the department. So one day before you see the basic histology, then you start with the basic slides. Okay, in the appendix, these are the things that you have to see. Then you go to the college back again, then you see those slides, and at least make a habit of seeing 5 slides every day. Okay, so this is very important. So once you start reading, then you apply that thing, you observe, and you start learning, and then the process is repeated. Okay, then you will see 100% improvement in your learning process. Second most important problem that I had seen is that there is an unnecessary fear of failure. Now remember, it is not your fault. Human beings, they have been conditioned to be negative from childhood itself. So when you are a child, okay, it was our parents, don't do this, don't do that. If you don't read, you will become this. If you don't read, you will come in the road. If you don't do this, this will happen. So you have always been conditioned like that. Human beings have been conditioned. So this amount of conditioning is there in everyone, including me. Okay, you look at the news channels, only those things are going to attract you which is negative. This is the human mind that we have been conditioned. And why am I using that word that we have been conditioned? Because we are not born with this fear of failure. Why? You see a child doesn't fear anything. A child, if you see a child, the child is just happy. And when you look at that child, a smile comes in your face because you remember the phase when you were, where you were fearless. You did not have any kind of fear. Okay, remember one important aspect of life, that you came without anything and you will go without anything. Okay, now remember what can happen at the worst. There are 2 questions over here. I want to ask you. Is there any resident, okay, that okay, who have not passed and yet is in the department after, maybe 10 years after residency, they are yet in the department? Have you seen any resident like that? At the most, what you must have seen is that someone has failed, and in the second attempt, they have cleared out also, right? So what is the worst thing, or what is the worst case scenario that can happen with you? You might fail. Is this the end of the world? It is not the end of the world, because 98% of the residents, they pass in the first attempt, and 99.9% of the residents, they pass in the second attempt as well. Very, very, very few residents might be, okay, and in third attempt, I am sure 100% they pass. So at the most, what want to happen? The fear is, I will fail, let me fail. What happens? You accept, okay, I will fail in the first attempt. So once you accepted the fear that, okay, I will fail, no problem. After that, when you start to go and read, you really enjoy and read, because you don't have the fear of failure. You accept, okay, I will fail, not a problem. Even if I fail, not. So if you have this attitude, and if you start reading, you will top not only your college, you will top the entire country, because you don't have any fear of failure. So remember this is how I used to tell me, the worst case scenario, I will fail once, but I will pass later. And the chance of this failing is how much? 0.001%. So even if I fail, what want to happen? I want to go back and I want to read again. I want to give second attempt. In the second attempt, 100% I will pass. Okay, but don't take this lightly. I am telling you I am telling you just to alleviate your fear. I am telling you in the sense, I am not telling you don't read, that okay, I will fail once, I will pass later, so I will stop reading. No, you don't have to fear failure. Okay, after your best attempt also, what might happen? Something might go here and there and you might fail. For example, a stupid examiner is there who failed you. Now, for example, what is the worst will happen? You will have the opportunity to give the exam later on also. This is the thing will happen. You will fail once, right? So once if that fear is gone, okay, even if I fail, nothing is all right, then you start reading fearlessly. And also one thing I will ask you, all the residents, don't you have an MBBS degree also with yourself? If at all they did not pass you, if at all you left the residency, if at all you didn't like the residency, if at all something like, you have an MBBS, you will not die without any food. You will always have a job. You will be earning decent amount of money to have a decent life. Okay, and you will be respectable in the society. So please don't fear. So live today as if there is no tomorrow. Okay, so once you start fearlessly, you start to enjoy things. So remember, don't have this unnecessary fear. Always remember, what will be the worst case scenario? This will happen. Okay, what will happen? Is it an end of the world? No, it is not an end of the world. Third important problem is that the professors are harassing, and this is a very sensitive topic. It is quite a sensitive topic. Now, why am I saying that it is a sensitive topic? Remember one thing, always remember, some professors are harassing, I agree. Some professors are rude, I agree. Some professors are vindictive, I agree. But remember, all these 5 fingers, they are not the same. Remember, there are some good professors and there are some bad professors. It is not like all the professors are bad. In a department, you might be having certain good people and certain bad people. And this is the story everywhere. You pass out from a department, you go to for any job, in that department the same thing. And it is not only in our medical colleges or in our private institutes or in our medical field. It is there in every field. Some people will always harass you. Some people will always be vindictive, and this is the nature of this world. And had it not been for the good people, our world would have finished by now. Our world is existing because some amount of goodness is always there, and that gives you a lot of hope. Okay. Remember one thing, sometimes what happens that the professors, they use some harsh word or they humiliate you, and not all of them. Okay, 10% situation, 10% cases you might have. Now remember, this might happen to you that a professor have shouted at you, screamed at you, have taken you down, humiliated you, or is back of you, always asking question or targeting you. Something might be there. Don't take it to the heart. Okay, don't take it to the heart. I will tell you. But remember, don't remain silent also. If this thing of humiliation, this thing of, targeting is very often repeated, and if you have become a target of a professor, then the first thing that you have to do is to go and communicate with the professor in a diplomatic and in a graceful manner. You ask sir, you tell sir or madam that sir or ma'am, you are asking me, I do agree whatever you are saying. I do agree I should read, in a better way. I should work more hard. But sir, I am reading every day. I am giving so much of time. After so much of work in the department, I am going back and doing, I am trying. You have to make the professor understand I am trying. And sir, when you are asking me or when you are targeting me like this, sir, it is, mentally it is not very healthy for me, and I feel bad about it. Okay, so if this thing repeats after 5, 6, 7, 8 times, you go and you speak. Here the key is communication. You communicate with the professor in a diplomatic way. You don't go and fight with anyone. You go, and because a fight never gets you a solution, it always makes more and more problem. But even after a proper communication with the professor, if you see that the same behavior, everything is the same, nothing has changed, and the professor yet is vindictive towards you, you complain, you go and don't do an official complaint, but speak with the HOD, head of department. Okay, and even after that, you see that the head is also not interested, not doing anything, and after that the same behavior is there, you go for an official complaint. But remember, this is the last step where your mental health is affected to the, to the tune that you become suicidal, because in that situation your health, your mental health is more important than anything else. In that situation, you go for the official complaint, go to the university. And even if the university doesn't help you, you can always approach the police. The legal system is always there in place in this country. So why am I telling you this? It is not like I am instigating you that go and complain, go and take a legal step, go and take all these things. No, I am not doing that. I am telling you that these options are there for you. So you don't have to take your life, you don't have to kill yourself, you don't have to take a drastic step, you don't have to do these things. There are certain way. You just need to communicate in that sense of heightened, tension when because see, suicidal tendencies is not like it is planned over a period of many days. Once you cannot take, maybe in that heat of moment, you take that step. But if in that heat of moment you just communicate that I am having such tendency, please make me calm, this is the problem, speak with anyone, and we are always there to speak with you even in kind of time of emergency. Okay, then all these things can be avoided. Okay, remember one thing, so remember it is very often repeated. So whenever it is very often repeated, remember, and it starts to affect your mental health, then only you go and do. Else, if you can develop a thick skin, I also tell you one thing, that as I've always mentioned, if a professor is at the back of you always or something like that, there were few professors in my department who were at back of me. Okay, and what I used to do, one good habit I used to have, I never used to get afraid. I never used to get I never used to get affected by the comments, and I used to develop a thick skin, and I chose to ignore, and after a period of time it stopped, because I did not care about that. It stopped, and the matters never went to the mental health or something, because I always chose to ignore. So always remember, the best policy, okay, is that you try to ignore the situation. You develop a thick skin. You don't fuel. You don't come in the eyes of the professors. You always stay out of the limelight. Try to be always silent in your department. Okay, so this is what I used to do. Okay, but I am putting a big but. I am not saying that you should not go and communicate and speak with the professor, HOD, or make an official complaint if the things for you is becoming out of hand, is coming big. Because for me, might be the situation was this, but for you the situation might be different. My mental health is different than your mental health. So I was able to develop a thick skin. I was able to avoid. So if you are able, in your according to your comfort zone, if you are able to ignore all these things and to continue on properly without affecting your mental health, please do that. But if you are not, these are the steps which are always available to you. Okay, as I already said, that don't get highlighted in your department. Stay neutral and out of departmental politics. Always be graceful in your behavior. As I always told you, that sometimes there are many residents, they speak in a very rude manner, and they don't even realize that they are speaking in a rude manner. And I have come across this. Many residents, they speak very rudely with me also. I never take tension about that, and I never say anything to the resident, but that is me. But I know that if you speak the same way with your teachers, if you speak the same way with your professors, with your HODs, you will have a reaction, because not everyone can become like a water like me. I seldom react to anyone, but I do get the tone. So always be graceful in the way you speak. Always be diplomatic. Always sandwich your problems to the teachers. Always, if you have any complaint against anyone, always put two breads between your problems and then present your problem. Okay, so this is very important. Lastly, everyone is just thinking about themselves. So I am saying the others, other people. Others means your colleagues, second years, first years, faculty. Do they matter? Will they help you pass? Only you yourself can help yourself to pass. No one will do that for you. And why you are thinking like that? Remember, majority of the people are like that, but not everyone are like that. And sometimes you will come across some very nice soul, some very nice people. Don't give, now remember one thing, don't give the power of your happiness or sadness in others' hand. And that can only come when you start taking independent decisions. Now, here I will go a little bit more personal in your life. Suppose you are married, you have a partner, or you have a girlfriend also. For example, I am saying you have a partner, or maybe your wife, maybe your girlfriend, maybe anyone. Or even, for example, your parents are there. So one important thing is that I see that people, they get frustrated when they are living according to other people's wishes. If you do that, you are harming yourself, because then you are only fulfilling, whatever other people are saying, and you are just wanting to make other people happy or sad. Even in your department, okay, even in your department, if you are becoming quite happy or quite sad because of anyone's comments or something, you are giving the power to their hand. So you start to make independent decisions, and that to a lot of extent can remove this problem. Now, always remember one thing, in this world that we are living in, previously when money wasn't there, there used to be a barter system, give and take. So this give and take is not today. It was there, a long time back, this barter system has been in place. Okay, because no one can function without this. Okay, you give something, you take something. Now, if you always think that I want to take and take, then the situation becomes problematic. So always try to give and take. For example, I will give you an example, and always remember, the give and take is not like I give you one banana, so you also have to give me one banana back. No, For example, in my residency period, what used to happen that there used to be, some residents had some problem and they were not able to do the night duty in the central lab. So many a times, when I used to be free and really when I did not have any problem, I used to do their nights. Now I did not ask them to do my night in return, but rather they used to help me in any way. For example, one day maybe I have a problem, then I used to ask them. So always whenever you're doing something, don't do it and expect that that other people will always do that. So in this way you create a very nice network and you create a very nice impression, okay, among your colleagues and among everyone. But if you are hard and if you are rude and straight off you are blunt in your behavior, bluntly saying no, I cannot do this and that, something like that, that vindictive nature if you yourself develop, then don't expect anything in return from anyone. So if you try to help someone in a very small way, you will always get something in return. Don't worry about the return. How and when it will happen, you don't have to worry about that, but that will happen. So remember, this world is functioning with this give and take system. So no one can function without this. Now remember one thing, leaving your parents, okay, except your parents, remember, the entire world is like that. No one will not care about you except your parents. Remember this. Now remember, in the first year, labor work is quite usual, as I told you. Okay, and by the time you come in the third year, don't worry. Okay, you will be forced to learn everything and you will be forced to take responsibility. So those of you who are in the first year, please do not worry that I cannot do this, or I did not learn this, or I am not able to do this, or I am not getting this much cutting, or I am not getting this. You will be, if you are in a government college, even in private colleges also, you will get cutting. And if suppose you are not getting to learn a lot even by the third year, after this you have opportunity for doing SRship in universities. You can go and do SRship in government colleges where you have to do all the work. Okay, so don't worry on that particular aspect. And remember one thing, first year is labor work. I will give you my example. Yes, you have to write down the reports, or you have to type all the reports, you have to do the clerical work. Okay, but you will not believe, even my colleagues used to give their clerical work on top of me and they used to go home, and very happily I used to sit down and I used to write. And people used to think that I am very stupid, but I wasn't stupid. When I used to write, I knew the only way to understand the language of pathology is to write down the reports. Once you write down the reports, you understand how the teachers, they are reading the slides. And you believe me, once you know the writing of the reports, then it becomes far more easier for you to read the slides under the microscope. So once you understand that particular language, and then writing down descriptions become a cakewalk for you. You will not believe, in the first year, and the end of the first year, we were in the end of the first year, just going to the second year, there was a slide test. And the first year, second year, third year, everyone was supposed to give the exam. And in that particular test, I scored around 24 out of 30. And I was the second highest. The first highest was someone from the third year, definitely, he got around 26.5 or 27. And to be very honest, that person who got the highest, actually he called me and he, before only he took diagnosis from me. I told him that this is supposed to be the diagnosis according to me. And then he only came first. But I'm not taking the names as now. But my point is, then the HOD called me, the teachers called me, and then they told me that, Jibran, that is it your writing? Have you not copied from anywhere? And I said no. And they asked me, they were so, they were so surprised how a first year can write so well. So the answer lies in this labor work. I used to do this labor work. I used to write down the descriptions. I used to, around 1:30, 2 o'clock, when most of the departmental work was over, I used to start my writing at 2 o'clock till 4 o'clock every day, most of the days. Okay, the entire first year I used to write down reports, and that is one thing that helped me a lot. Now, some other problems that I have already highlighted, that balancing family and work, especially for those who are married, living with their in-laws, sometimes that can be challenging. But in those situations also, you have to balance your life. For that, you have to have a better planning. Sometimes you have relationship problems, issues. Some people are going through divorce, separation, or breakup with girlfriend. I myself had faced relationship issues in my first year and I didn't know what to do. For 1 week, I just didn't show up at work. I just didn't show up at work. And even if I used to show up at work, suddenly I used to leave the department. That had some repercussions, but what I wanted to say, that phase passed. Now, jealousy will always be there, but jealousy to the tune of healthy competition is all right. But jealousy to the tune of doing something bad to others, hurting others, that is bad. That should not happen. Jealousy, a healthy amount of jealousy, for healthy competition is all right. But if you become jealous enough to think bad about someone else, or you wish bad, you wish that other person fails, you wish that other person don't do well, you wish that this is wrong, you cannot do that to anyone. Okay, that is a sick behavior. Now, coming to the next important heading is some of the do's and don'ts in residency. So I will just read out these do's and don'ts I had shared with my residents who are in our WhatsApp group. So remember that suicide is never an answer to any mental breakdown. All issues can be resolved and nothing is permanent, not your happiness nor your sadness, and everything will pass. So remember this point. People never want to teach someone who brags knowledge or tries to impress. So always stay humble and be less noticed among colleagues as well as faculty. You speak only when you are asked to. Maintain low key, become a seeker of knowledge. Third important, remember the one aim that everyone should have in mind, that you have to pass, you have to take your degree, you have to move on. Nothing more, nothing less. Even if you learn less, there are multiple opportunities after passing out in terms of learning. Without a degree, you are stuck in that department. Remember this point. I am telling this point again and again. Now, by this, I don't mean that you don't strive to do better. I am telling you that keep this in mind. The first day you are entering the department, that one day you have to leave. The shortest way is to pass in the first attempt. So I should read properly. I have to take my degree, I have to move on. So you don't have to fight with anyone over there. You don't have to, do things over there, that makes difficult for you. Okay. So you have to be less noticed. You have to take your degree, you have to get out of there. So you are not going there to make relations with anyone. You are going there to seek knowledge, take your degree, pass out and have your life. You never fight or argue with your seniors, professors, juniors, HODs or any administrative staff, whatever the reason. Don't speak about the application of website about a Simply Pathology with the teachers, because they will, see you like, oh, you are seeing this. Okay, you cannot answer this question even after looking at that. People have a tendency to show other people low. Okay. So once you start speaking about all these things, you make yourself an easy target. They will always catch you and ask you questions, and questions so much difficult, okay, that no one will be prepared to answer. But they will ask you such questions that you will never be able to answer. And as a result, okay, you will become a good and easy target. So don't speak about application. Even it is against my advertisement only. So don't speak about that in the college. You eat the fruit, you don't count the seeds. This is what I tell everyone. Fifth, always when you are asked to quote standard textbooks. Everything that we do is based out of standard textbooks like Robbins, WHO, Fletcher's, Ackerman, Sternberg, Orell, Deci. Okay, all these other standard books. Always take name of standard books. Maintain respect with your co-PGTs or with your colleagues and try to maintain a healthy competition. You don't have to share any of your personal problems at workplace. Remember this. Your residency life should be limited to college. Your family and personal studies limited to your home. Lesser you reveal at your workplace, lesser judgments about you, so you remain low-key. When you remain low-key, no one can stop you from passing because you are a neutral figure. So these are some of the very important do's and don'ts in your residency program. Okay. And now just give me 5 to 10 more minutes. I'm going to end this with some basic life lessons. So communication, I'm not going into details. I've already discussed about communication and the importance of communication. And this point also I have discussed in details, that time heals everything. Even if you are in a bad situation right now, that will not stay forever. And even if you are in a good situation right now, even that is temporary. So everything is temporary. Have patience. Patience is very important, especially for the first year residents. You will learn everything and everything will happen with time. So don't worry. Have a clarity of vision or a goal. As I told you, one of the biggest thing that you cannot concentrate and that you waste a lot of time in is when you don't have clarity of vision and goals. You should have a planning diary. Planning diary can be physical or mental. What do I mean by that? I mean that today at night I am going to sleep. In my mental diary, I am putting something. Okay, tomorrow I have to do this work. I have a basic plan one day before what I have to. So your mind is prepared. Next day, if you wake up, you don't have a plan. Then you think, I will do this only. I can do this also. I can do this also. I can do this also. And then the time goes. So if you are not planned, you end up wasting a lot of time and energy. So have a clarity of vision, have a clarity of what goals, and goals are not like only long-term goals. Goals can be on a daily basis also. Okay, and in pathology residency decoded video, I have given you very clearly the timetable that you have to follow, what you have to do. Okay, so please see that video. Then make a point always to spend some time on things that make you happy. It is very important. Okay, for example, you love to drive cars. If you don't have a car, ask your friend cars. See someone near of you have car. If you have your own car, just go for a drive. If you like to have some food or a particular, food like biryani you like, then in a week once, you go for that biryani. Or for example, you like to listen to some song, watch some movies. Okay, so something that makes you happy, spend some time every day on yourself that makes you happy. This gives you more reason, okay, next day to work hard, because again you can go to something, to make yourself happy. But if you're only reading, you will become frustrated. Go out at least every day for 10 to 15 minutes, do some exercise and connect with nature, because all of us are coming from nature. That gives you a sense of, being attached to this world. Always remember, don't take your work to home and don't take your home back to your work. Remember one thing. And one more personal advice I will give you. If you are in your, if you are married, marriage occurs between a husband and a wife. You should not take your marriage to your parents, neither your in-laws. It should only be in the circle of your marriage. So remember this point very importantly. This is very important. Your marriage should not go to your parents or to your in-laws. It is between you and your partner. Okay? You should have a routine to cover all subjects, which I have discussed in details multiple times. So please see this video, Pathology Residency Decoded, the link to which I will give in the description box. You limit the time which is spent on the social media, and I told you why it is important to limit the time on the social media. Residency is part of your life and not all of your life. Remember, you have certain dependents. Suicide is never an answer to anything. Once you die, what want to happen? One day, 2 days, your friends will cry. Third day, you will be replaced by someone else and life will go on. Then if you have a partner, if you have your child, if you have parents, they are the one who will suffer. You too have gone. But has anything good happened with your life? Did it solve any problem? The world is going on the same way. So it will not solve anything. Rather, it will make more problems for your family. So remember one thing, suicide is never an answer to anything. Always be graceful in behavior no matter the situation, as I told you. Even after you have given your best, okay, there will be times when you have very bad days. The things will not go according to your wish. You will feel down. And it is all right. It is completely all right. Remember one thing, till you can see with both your eyes, you can smell with your nose, you can have the taste sensation, you have hands, legs, you are able to walk, you are able to, walk, talk, understand things, when you are able to do all these things, I feel you are blessed. And I feel, so always remember this thing. Look at those people who cannot see, those people who cannot walk, who cannot talk, who are not mentally sound. Okay, and look at yourself. Then think how much lucky you are. Remember this point very carefully. And as I always say, that if you are religious, please pray. If you are not religious, do yoga. But in some way or the other, spend time with yourself, because in this way, when you pray, when you do yoga, you try to connect with your subconscious, and that makes you very concentrated in your work. Okay, that gives you goal-oriented focus. That helps you concentrate. Okay, that helps you stay away from the social media. So 5 to 10 minutes every day, if you can pray or do yoga, it is going to help you a lot. And I would just like to end by saying that we at Simply Pathology have started the counseling sessions as well. Even after watching this video, if you feel that you need regular counselings, please do contact us in our WhatsApp at least 24 hours before. Okay, we will book your slot for counseling and provide the relevant services. Thank you very much for listening. If you have listened till this point of time, thank you very much.